Well, hello there, AP2 students. It has been a while since I've seen you here in video land. What I would like to do today with you is go over some of the histological concepts that will help you understand some terminology that we're going to be using for the rest of the semester. We'll be looking at the architectural makeup of the walls of hollow organs, and we're going to look at the membranes that we're going to be talking about again in the near future. Now, although this is your introductory lecture for the respiratory system, this discussion will be relevant and applicable as we look at other systems as well. Let's begin by looking at the common features of the makeup of the walls of hollow organs. And let's borrow this picture of the digestive tract and label the different layers from the lumen out. And the four layers that make up these walls are the mucosa, the submucosa, the muscularis externa, and the serosa or adventitia. Let's take a look a little bit more closely at these layers and then switch to a different view. I'm going to use my trusty purple arrow to show you the four layers of the wall of this hollow organ. And so from the lumen, we'll move outward, and the first layer is the mucosa, which is right here. And then the next layer is the submucosa. And then moving outward some more, we get the muscularis externa. And then the outermost part of the wall here is the serosa. I've borrowed this drawing to show a little bit more detail of the mucosal layer, and then we'll take a look at some histological sections. Focusing in on the mucosa, we see three layers. The innermost is the epithelial layer, and this lines the lumen. Then we have a loose connective tissue layer called the lamina propria, and then a thin muscularis mucosa layer of smooth muscle. Let's finish up this diagram by naming the rest of the layers in the wall. So here's the submucosa, and then we've got two smooth muscle layers of the muscularis externa, and then the outer serosa layer. This gives us a nice framework for the understanding of the typical structures of the walls of the hollow organs. For each system we learn, and different regions within a system, we will see variations on these layers, but the basic framework will be the same. Here is a histological section of the esophagus from your textbook showing very nicely the four layers of the wall. We consider this a cross section because it has been cut across the length of the organ rather than along it. This sort of cut gives us ring-like sections with a hollow center. Now let's grab my trusty arrow again and turn it black this time so that you can see it better. And we'll start here again in the lumen. So let's start here with the mucosa, and then we'll move down into this area. This is the submucosa, and when you see glands, you'll know that you're in the submucosa. And then we have two very large layers of the muscularis externa, and then we have an outer layer of adventitia. Well, you might be asking yourself, why is she calling the outer layer an adventitia now? We've been calling it the serosa. Well, when an organ is adhered to its surrounding structures, it has an outer adventitia, which is a fibrous connective tissue. We saw this with the blood vessels. The connective tissue blends with its surrounding connective tissue and gives that characteristic tearing sound when dissected away. However, some organs within the thoracic and abdominopelvic cavities have not only connective tissue surrounding the outside, but also a simple squamous layer called a mesothelium. Together, the outer loose connective tissue and the mesothelium are called the serosa. We will see the serosa in the lungs as the visceral pleura, and we saw the serosa of the heart as the epicardium or visceral pericardium. And I'll agree with you that all these different names for the same structure is getting a little crazy. But this is one of the hurdles in A&P that needs to be jumped. Let's look at two more slides of the esophagus to identify these layers, and then we'll move on to talk about the membranes. Okay, so let's just talk through these numbers, and I'll walk you through it. So number 1's the lumen. Number 2 is the epithelial layer of the mucosa, which in this area of the esophagus is a stratified squamous. Number 3 showing the connective tissue layer of the lamina propria, and number 4, even though it's hard to see, is a thin layer of the muscularis mucosa. Number 5 is the submucosa, and we see a lot of submucosal glands, and these glands produce a lot of mucus. The 6A and 6B are the two layers of the muscularis externa, and number 7 is the adventitia. In this slide of the esophagus, we see very nicely the stratified epithelial layer of the mucosa. We can see the lamina propria, and we can see a very nice delineation between the lamina propria and the muscularis mucosa. And then further down, we see the submucosa, and we see some more glands there, and we see some of the connective tissue of the submucosa. And then we can catch a glimpse here of the inner layer of the muscularis externa. The last thing that I want to talk to you about are the membranes of the internal organs. In A&P 1, we learned about the three membranes of the body: the cutaneous membrane, the mucous membranes, and the serous membranes. And guess what? These membranes have lots of different names. The cutaneous membrane we learned as the skin and as the integument. The mucous membranes we just learned about as the inner lining of the hollow organs. Now, the serous membranes have lots of different names, and we're going to look at some of those a little bit more closely now. Now, there are the lungs. I bet you never thought we'd get to them. Now, the word serous means watery, and each of the serous membranes produces a thin, watery fluid. And in the lungs, this fluid is vitally important to the mechanics of breathing, and we'll elaborate on that when we talk about breathing mechanics. The serous membranes in the thoracic cavity that are related to the lungs are called the pleural membranes. On the outside of the lung tissue is the visceral pleura, and lining the inside of the rib cage and the superior aspect of the diaphragm is the parietal pleura. And within the two is a small space called the pleural cavity, and this is where you will find the pleural fluid. These membranes are simply one single membrane folded in on itself, and it's continuous, and this continuity is vital to the function of the lungs. And within the pleural cavity is a slight vacuum, and the continuity of the space and the fluid and this vacuum is very important. So much so that if there's any breach, that a lung could collapse. And we will explore this in more detail at a later time. So let me leave you with a question. What is it about the nature of water that causes this fluid around the outside of the lung to be so important in the breathing process?